All right, welcome to today's explainer. Today, we're taking a deep dive into the very breath of life and, well, what happens when that breath is compromised. We're looking at an absolute masterclass in medical mapping, Chapter 15 of Professor Harsh Mohan's 7th edition textbook of Pathology. And this text doesn't just list diseases, it literally gives us a structural blueprint of respiratory failure. So let's jump right in and decode exactly how the respiratory system breaks down, step by step. Here's the roadmap for our blueprint today. We'll start with the normal structure of the lungs, move into pulmonary infections, then tackle chronic obstructive pulmonary disease, restrictive pulmonary diseases, and finally, tumors of the lungs. First up, Section 1, the normal structure of the lungs. So to really understand pathology, we have to start at the absolute baseline of healthy function. Professor Mohan anchors us right here first. And honestly, this isn't just some introductory filler, it's the vital foundation. In medicine, you absolutely cannot spot a deviation if you don't know the gold standard inside and out, right? Every single infection, every mechanical blockage, every tumor we're going to look at today is measured by just how terribly it alters this exact, normal, anatomical, and functional baseline. Moving right along to Section 2, Pulmonary Infections. Okay, so from that baseline of peace, what happens when our defenses are breached by microscopic invaders? Well, the textbook actually categorizes these fast-acting assaults into 3 main groups. First up, pneumonias. These are acute inflammatory responses that basically fill the air spaces with fluid and cellular debris. Then we have lung abscesses, which are a much more localized, destructive, pus-filled process. Yikes. And finally, pulmonary tuberculosis. Organizing them like this is actually brilliant. It draws a super clear line between massive, diffuse invasions and targeted, localized tissue destruction. Now, once we move past those acute infections, we hit the chronic mechanical breakdowns. And here is where we find the great mechanical divide in respiratory failure: obstructive versus restrictive diseases. Okay, picture this. Obstructive disease, it's like struggling to exhale through a tiny, narrow plastic straw. All that air gets trapped. Restrictive disease, on the flip side, is like trying to take a deep breath while wearing a really tight corset. Your capacity to expand is completely locked down. Grasping this distinction is literally the core of respiratory pathology. Let's dig into Section 3, Chronic Obstructive Pulmonary Disease. Diving into that straw side of our analogy, the textbook lays out 5 specific obstructive conditions. The 2 heavy hoarders here are chronic bronchitis and emphysema. To put it simply, chronic bronchitis is basically a disease of the airways. Think excessive mucus and chronic inflammation that just narrows everything down. Emphysema, though, is a disease of the air sacs themselves. The walls of the alveoli are actually destroyed, leaving the lungs hyperinflated and kind of baggy, so they just can't push air out effectively. We also see bronchial asthma, bronchiectases, and small airways disease in this category, but they all share that one fundamental flaw. Getting air out of the lungs becomes incredibly difficult.
Which brings us to Section 4, Restrictive Pulmonary Diseases.
All right, transitioning over to the corset side of things, we're looking at chronic progressive restriction. Unlike obstructive blockages, restrictive diseases, which are often called interstitial lung diseases or ILDs, are all about the actual scarring and stiffening of the lung tissue itself. The textbook breaks these down into 5 distinct associations. We've got pneumoconiosis, which are essentially environmental or occupational death diseases. Then there are ILDs tied to immunologic and connective tissue diseases, meaning systemic issues are basically attacking the lungs. We also have idiopathic pulmonary fibrosis, where the cause is totally unknown. And finally, ILDs directly linked to smoking. And the slow pacing of these diseases really mirrors their nature. It's a gradual, tightening corset on the whole respiratory system.
Finally, Section 5. Tumors of the lungs.
We've reached the climax of our pathological journey, moving from physical, mechanical failures to the ultimate cellular mutiny. The textbook introduces bronchogenic carcinoma. This is the primary, absolutely devastating lung tumor highlighted in the text. It's a profound failure, not just of mechanics, but of the very genetic instructions of the cells themselves. It's a malignant transformation arising directly from the airway epithelium. And honestly, when you look at the structure of this entire chapter, almost everything else we've covered, the baseline, the infections, the chronic damage from smoking, it all serves as this tragic prelude to this specific cellular rebellion. But of course, bronchogenic carcinoma isn't the only threat on the board. To round out the tumor category, Professor Mohan details a few other classifications. We have bronchial carcinoid and neuroendocrine tumors. These are primary tumors too, but they behave quite differently than typical carcinomas. Then there are hamartomas, which are actually benign. They're just disorganized masses of tissue. Think of them more like a developmental glitch rather than a malicious cancer. And finally, metastatic lung tumors. This part is crucial. Because the lungs act as this massive capillary filter for the entire body's blood supply, they are a prime target for metastatic invaders that started in completely different organs.
So as we wrap up this explainer, I really want to leave you with a final thought. We've journeyed through complex categories and anatomical definitions from totally normal structure all the way down to devastating carcinomas. But why does the strict organization matter so much? Because, well, a problem simply cannot be solved until it's precisely defined. How does mastering these exact textbook classifications act as the critical first step toward curing them? Think about it. By breaking down the absolute chaos of respiratory failure into neat, understandable categories, infections, obstructions, restrictions, tumors, this structural blueprint bridges that massive gap between raw pathology and future medical breakthroughs. Thanks so much for diving into this with me today, and keep questioning how the structure of information today leads to the solutions of tomorrow.